Andrea back again with another nursing related video. If you are new to my channel, please be sure to go ahead and hit that subscribe button. If you haven't already, go ahead and hit that notification bell. Okay guys, so today's video is actually a collab, my very first collab with the Nursing Navigator. So half the tips are going to be on my channel and the other tips are going to be on her channel. We're going to have a total of 10 tips to help you survive your clinical experience. So I will link her channel down below. Be sure to go ahead and check out the other 5 tips on her channel. So yes, as you can tell by the title and like I have already said, I am going to be giving you guys 5 tips to survive your clinical experience. To be real with y'all, clinical is totally different, especially if you're an incoming first semester, newly, nursing student. Clinicals are not like, of course, they're not going to be like your lecture classes. This is where you'll be able to go in, practice your skills, actually see things in reality. So, and, it's a lot different. And it can be really, I guess I don't want to say overwhelming, but it's like I said, something different, something new. It's just like, starting the new program. So I just want to give you guys tips to help you survive and get through your clinical experience. Okay, so tip number 1, when it comes to picking your patient, and I know not all programs do this. They have it set up to where like the charge nurse will pick your patient or your instructor will pick your patient. For my program and other programs, I'm sure that are out there, we actually got to go in like a day before and pick our patient. So when it comes to, picking your patient, I do want to say, when you go in and you pick your patient, you do make a care plan over this patient, over, what are they admitted for, what are the medications they're taking, and sometimes, of course, right off the bat, you would think, get the patient that's not as sick, get the patient that doesn't have that much stuff going on with them. That is exactly the opposite of what you want to do. You want to get the most sickest, the most difficult patient, because when it comes time to make your care plan, having that sick, difficult patient is going to help you so much when you have to come up with those patho trees, when you have to come up with, different interventions. Having an easy patient is not always, the best route to go. Okay, my next tip is going to be, and this kind of, I guess, goes later on down the line once you, proceed through your semester. If you have not done something, say for example, if you have not inserted a catheter, if you haven't did a bed bath, if you haven't made a bed, and you want to do that and you want to get that experience, and you have to ask. Because a lot of the times, I will be real with y'all, nurses don't always put forth that opportunity to you. You have to go, you have to ask, you have to let them know that you are ready to learn, you're ready to get that experience. And honestly, from experience myself, when I asked, can I do this, can I do that, that is when they started to present more opportunities to me. So the more that you show that you actually want to be involved, you want to learn, the more opportunities that will present to you. Okay, my next tip is, and I highly recommend this tip and then my next tip, but we'll get to that in a second. So my next tip is going to be, you want to get you a clinical, companion guide, some type of little pocketbook, something that is going to help you, come up with your nursing diagnosis, that's going to give you some interventions. Because, guys, when it comes to making your care plans, you have to come up with your nursing management. You have to come up with a nursing diagnosis, have, what outcome do you want for your patient? What goal do you want? And then also, how are you going to make sure that this goal is achieved? So having, that clinical guide, and you can get a lot of these off of Amazon. They probably sell them at your school. Just something that is going to help you come up with nursing diagnosis and, interventions. And a lot of times, a lot of my professors, when we did our care plans, we had those interventions, they wanted rationales. And those rationales had to come straight out of a book. So if you have that clinical guidebook, if you have, some type of book that has NANDAs all in them, you can, use that book as a source, and there you go. It makes it that much easier for you. Okay, my next tip that I highly recommend, that I honestly feel like you won't be able to survive clinicals without it, is a drug pocket, little, something that can fit inside of your pocket, a drug guide book. I had a professor, I believe it was actually my first semester of nursing school, we weren't allowed to pass out meds if we could not tell her what the medications were. And I'm not saying that, you guys have to memorize them right off the bat, like you're expected to know this whole book. Absolutely not. But as you progress through your program, as you go from semester to semester, drugs are going to start sticking to you. And then once you take pharmacology, the drugs are really going to stick into your memory. You're going to see, how these, class of drugs sit together, how these are opposite from that class. So, but, just having this pocket drug guide book just to have on hand to pull out, look up a drug, see, if there's any interactions. with drugs that your patient's already taking. It can be so beneficial, so helpful, and you will thank me later. So be sure, again, you can get this off Amazon. I got mine off Amazon. It is so helpful, guys. And then my last tip, of course, is going to be just enjoy it and have fun, because honestly, this is the time and the place for you to practice your skills, to get all that experience, all that practice in that you can, before you actually become a nurse and you are, you know, out there on your own. So again, don't be afraid to ask questions. Don't be afraid to ask if you can do things. The worst thing they can tell you is no. Okay, cool. So you have next week to come back and, you know, ask again. Just have fun, enjoy it, and make sure that you're actually, you know, getting your practice in, you're mastering your skills, and if you have any questions, you get those questions answered. But yeah, guys, I mean, that's really all the tips that I have. Those are my 5 tips. Those are 5 things that help me, you know, get through and enjoy my clinical experience. Again, please make sure you click the link down below, go to the Nursing Navigators page and watch her 5 tips, and also subscribe to her channel as well. I hope you guys enjoyed this video. Be sure to give it a thumbs up, subscribe, stay up, stay with it, and I'll see you guys in the next video.